How can you get an avoidant man to bond with you in the bedroom through great sex? Is it a problem if you ask him for your sexual needs? And if you're trying to conceive a baby, how important is it for you to make sure you're having an orgasm? Hey guys, I brought on an expert today because so many of you have written in the comment sections asking me exactly how attachment issues can impact your fertility, your sexual pleasure, the health of your baby, your breastfeeding experience, and everything that's involved around parenting, around your body, and around everything in there. You know that a few weeks back, I had Dr. Sue Carter, the leading world expert about oxytocin and vasopressin bonding on, and she shared so much information with us. I recommend you check out that episode if you missed it. But today, I wanted to bring on someone who is practical, who is in the field, who is working with oxytocin and other chemicals in a way nobody else is. I was on her TV show recently. She is starting a new wave of good, genuine health for people. She's also creating, and I should say leveraging, a method that is more effective than IVF at creating a robust, healthy child, even for women who have fertility challenges. It's not a one-size-fits-all, but it seems so far like one of the best fertility methods I have ever heard of in my life. Let's welcome Jessica Preston to the show. Jessica, thank you so much for being here.
Thank you so much for having me, Adam.
Today, I want to introduce you to my audience because they're wonderful out there. Hey, everybody out there. A lot of them who are listening right now are ladies at home who've been struggling with anxiety most of their lives, especially in relationships. We call it anxious attachment style, something I know you're familiar with. They are anxiously attached or have been in the past. They have a lot of challenges around sharing their needs in relationships, around articulating their desires. Sometimes sex is a challenge for them. Many of them, how do I want to say this carefully? Ladies, forgive me if this doesn't come out right. Many of them are used to sacrificing their own pleasure in the bedroom, especially to make their partner feel loved, to try to maintain and sustain a relationship. It's very, very challenging for them to find that joy. And then many of them have what we would probably consider an oxytocin deficiency, where they exhibit the signs of it: more mechanical behavior, less happiness, less GABA. So they have more cortisol spiking in their system, and they really crave that connection with a partner. But unfortunately, they often go to avoidantly attached men who don't really understand their needs or won't meet their needs. So then if they have fertility challenges, yeah, of course, that's going to go along. It's going to be right in your wheelhouse to share why that's happening. But fertility challenges, pregnancy challenges, breastfeeding challenges, this is something that I've explored in my work with clients, but it's not something I get to talk about very much here on this channel. So I am so thrilled to have you here. Could you please really quick explain just a little bit about what you do to the audience, because there's so many things that you do.
Yes, thank you so much, Adam. So I have spent the majority of my career in medicine. So I'm a physician assistant working in obstetrics and gynecology. My background's biochemistry, so I went into functional medicine, and I started noticing that I was helping people make healthier babies by optimizing egg and sperm health and reversing infertility. And so we have this entire program that we've put together. We are nationwide. We have small programs to large programs, helping people conceive and helping people that are struggling with conception and that aren't struggling with conception, because everybody wants that healthy baby and to have that healthy relationship. And a big focus that we have is on that relationship itself. We want to help those partners really bond and connect so that they can have a solid foundation for their growing baby, happy, healthy, safe, emotionally safe home to be able to raise your children, ripple effect that out into society and make a change in that space. Also, so that we can, when our babies leave the nest at 18 or older, then we can return back to that loving space of connection that we had prior to bringing those babies into our home, so that we can continue with that same nurturing, deep, loving relationship throughout the rest of our lives.
Now, you said something in there that's very, very crucial. A lot of women today struggle with healthy eggs. Sometimes that's from chemicals. I've heard it can be from birth control. I'd love to hear a little bit about that maybe from you. But so many women, they go through their 20s. They can't connect to the right guy. They're waiting. They're being responsible. They're trying. Maybe they're 29, 30, 31, 35. They're somewhere in that window. Now they're really worrying about the health of their eggs. They're worrying about finding the right partner. I have heard it said before, and I don't think I agree with this, but I'd love to hear your take on the science. I've heard here in America, the message seems to be, well, the health of your eggs, it's kind of what you have. They get really hurt or they're damaged somehow and you can't really fix it. We need to do full IVF. Here's the number, put your credit card in. That's a lot of the messaging that women seem to get is you're screwed if your eggs aren't healthy anymore. Is that true?
No, no, not at all. And I would love to debunk that right now. So there is one test called AMH that women tend to do to talk about egg reserve, and it's a general test. And if you're a low number, your provider will frequently say your egg reserve is low, or you have unhealthy eggs, or you are less likely to conceive on your own and move you quickly to IVF. Now, having been in conventional medicine for 20 years, I do understand that push because we want to make sure that you have a baby if you want one. So the urgency is yours and the urgency is also ours. So that's why your provider, who really does care for your outcome, is going to try to move you along that track quickly to get to IVF. And then at IVF, they are with their structures and with their research, which is very much in that conventional space, and they have the way that they can help you make a baby. Now, there is some literature that says that we can have a slight increased risk of autism in our babies with IVF, specifically ICSI, where sperm is injected into the egg. And then there was literature that was brought out November of 2023 that said those of us with subfertility, so a little less likely to conceive, also have a slight increased risk of autism in our babies. And we attribute that a lot to egg and sperm health in a lot of ways. So the question is then, should we be concerned? And the answer is mindfully, yes. But there are things we can do. And a lot of those are found in the functional medicine realm, which is more lifestyle medicine based. And I think a lot of people are concerned when you hear lifestyle medicine, it sounds like it's a little frou-frou, but it's not. And when we think about conventional medicine and we say, okay, your cholesterol is high, our first thing that we do is we put you on a low cholesterol diet or we change your nutrition plan, and that works. It works in conventional medicine, it works in functional medicine, and it works for your egg and sperm health. So we can actually take that number I was talking about, that AMH, if it's low, and we can actually make that number increase. We can improve the health of your egg and your sperm. Now, for eggs, it takes 90 days, and for sperm, it takes 72 days. So we really want you to implement those lifestyle changes, and we want you to do those consistently for 3 months. Optimally 6, but we really can't in our program get people to wait that long. So as long as I can get you to wait 3 months, then we have a much better possibility of healthier egg and sperm, healthier baby.
So if a woman comes into you, let's say she's 35, she's found the right partner, they just got married, maybe they beat those odds, they're happy together, they want to have a baby, and a doctor has told her that she has very poor egg health. Is she screwed? I mean, if she comes to you, is there no hope?
No. First thing that we say is, okay, let's get started now. We need to start optimizing where things are for your egg and sperm health. But no, we are absolutely able to improve the health of egg and sperm. So let's talk about a few of those methods so it doesn't sound like magic. Does that sound?
Yeah, I know. Because everyone at home, so a lot of people, religious people in particular, are very uncomfortable with IVF. It's one thing I love about your method is it is 100% ethical, natural. It is fully in line with everything that a religious person could really follow and get behind. We should all actually be doing your method right now. Even if we're not trying to conceive, we should be living to your methods because I've studied them a bit. They're phenomenal. But along with that, we really need a little bit more detail. What can women look at? What can they expect here about your method?
Okay, so what we're looking at 5 different factors. So we're looking at your nutrition. What you put in your body is important. If you think of it like this, we need to have vitamins in our body. Some women have heard of folic acid in your prenatal vitamin. We use a form called methylfolate, which is basically primed and ready for your body to be able to be optimized for egg and sperm health. But with folic acid, we need a certain amount to prevent neural tube defects, spina bifida, for example. That we know in conventional medicine, that is a nutrition aspect. Yes, we take a prenatal vitamin, but there are also things that we can do in nutrition to optimize those nutrients. So we remove things that cause inflammation because inflammation gets in the way of getting pregnant too. So I want to make it very simple. When we have inflammation in our body from the foods we eat cause inflammation. So think of it as like processed food or colors foods have, dyes and artificial substances that actually our body has to respond to because it's not natural, causes an inflammatory response. When we have an inflammatory response, that causes a cascade that decreases our fertility. So when it comes to nutrition, we remove the inflammatory things and we replace them with things that are nutritious and very healthy for egg and sperm health for you and for your body and your baby. So the next thing that we look at is stress. We have to manage your stress. If our stress is high, and I know we're going to go deep into this because this is that anxious attachment style where we feel a little bit of stress all the time, and that we need to find a way to address. Nothing is magic. There are ways that we can get in there and address these easily to make you feel safe in your nervous system, feel calm so you aren't feeling out of control in that. When we are stressed, cortisol goes up, and that is a stress hormone. And when that goes up, our female sex hormones that help us with fertility go down and make us less fertile. So we do actually have to make a change in that. So we address that in stress. Let's talk back at nutrition, because all of these things connect together like this. So in nutrition, if I don't make sure that you have all of your B vitamins, we need the B vitamins to make serotonin, norepinephrine, dopamine. So to feel happy, secure, healthy, we need those to be made. So that's our nutrition and stress go together. When our stress is lower, we make better food choices. Then we look at sleep. If we don't get enough sleep, we'll focus on men for a minute. Men need 7 to 8 hours sleep to make testosterone. We need testosterone to make sperm. So, and to be fertile. So if we don't get appropriate amount of sleep, and for women, if it's not enough, our progesterone goes down. Then we end up with luteal phase defects, for example, where our cycles are shorter than 28 days. And that's becoming more and more common. If your cycle's shorter than 28 days, you don't have enough time for implantation to occur. So we need to lengthen that. How can we lengthen that? We can lengthen that with your nutrition, your stress, and improving your sleep. And we do it within 3 months. So with that, you could have 10 years, you could have a 24, 26-day cycle. And within 3 months, we can basically get you set. So if you do what you're supposed to do.
One big problem I've seen a lot, and I'm going to be sensitive here, but I know a lot of the women in the audience have experienced this, is a lot of anxiously attached women have exactly that problem you talked about. Their hormones go way down, their fertility goes way down. So even if when they do conceive, their rate of miscarriages is much higher among women who have chronic anxiety. Anxious attachment style actually increases your risk of miscarriages. Ladies, just look it up, please. Just keep yourself educated on it. It's really painful. I'm going to be sensitive here to this, but does your method improve that? Does it cut down risks of miscarriages, for example?
Yes. And I want to be cautious. Yes, 100% yes. But I want to be cautious on how we approach this, because I want everyone to understand it's not the anxiety itself that is causing your miscarriage. Because what happens is we feel anxious when we're early pregnant and we're trying to conceive. And then we say, my stress is going to cause me to miscarry. My stress is going to cause me to miscarry. That's not what is causing you to miscarry. It's the cascade effect of what happens internally from the stress. So as long as we get some tools on board to be able to manage that stress, it's okay to feel. I'm not trying to get you to avoid feeling that anxiety. Actually, I would like you to feel the anxiety. I would like you to notice you're feeling the anxiety. And then I'd like us to give you some tools to help you feel less anxiety that will make you feel better in 1 minute, 2 minutes. And we can talk about some of those today. So let's talk about one right now. I don't want people to have to wait, when is this coming up? So vagus nerve, which is basically the nerve that is controlling our parasympathetic, which is our rest, digest, and procreate. So that's what we need to be in more of in order to conceive. So if we're feeling really stressed, if we can stop and notice we're feeling anxious, just notice you're feeling anxious. Even notice where it is in your body. Frequently it's here. It's like right here in our chest. Sometimes it's in our stomach, wherever it is. You can put your hand on it. Just stop. Notice that you're feeling stressed. Take a deep breath in. Breathe in a little more. And exhale longer than your inhale. Do that 3 times. It's a physiologic sigh. It will help you reset into your parasympathetic. Okay, so notice that anxiety. Stop. I'm feeling anxious. What do I need to do? Locate it in my body. Put your hand where it is so you can feel it. Okay, this is somatics. We're going to feel where it is. Do 3 physiologic sighs and just move forward. If that's not enough, I have one more thing. So your ears here. So you can see your ears. What I want you to do is I want you to massage down your ears like this. So you can just massage your ears when you're feeling stressed like this. This is another thing that's going to put you more on parasympathetic. Deep breath in and out. Just do it for half a minute or so. It's going to make a difference. So those are 2 tools that you can use right now. So back to the topic, we can see that anxiety can cause that increase. So we want to help manage the anxiety piece, which brings us to another component. What we work on is relationships. So it is actually my favorite part of our program. The other one we didn't mention, if you're curious about the 5, is exercise. There's a certain type of exercise when trying to conceive that you need to do as women, and a different type for men. So we address that. But relationships are my favorite piece because it really is about connecting with that person who you're going to make a baby with. And it is a big challenge because the one person we're connecting with that we want to have our family with is the one person who we have the most at risk with. So that's when we're so challenged with our attachment styles.
I want to jump into this relationship piece with you here in a moment. But first, I have one more question because you touched on this a little bit earlier and you said something really fascinating to me. A lot of women are so focused on the conceiving part and then the keeping it part, right? Conceive the baby, keep the baby, bear the baby full term. They're so focused in on that. And then they hope that it's going to go well after that. But you said something interesting earlier about creating healthier children who have longer term, better outcomes. You mentioned to me something just before we